Should I pray as we wait for the moderator? Shall we believe and pray? Father, in the mighty name of Jesus Christ, we come to you at this particular moment. We thank you, King of Kings. It's us, your children, again. We present ourselves unto thee, O Lord, as we want to begin this discussion. May you give us your divine knowledge, guide us from the beginning, be the middle, and be the end, O Father. I pray for each and every one of us who has joined this session, O Lord. May you bless them. May you meet each person at their very points of need, O God. As we undertake this process, guide us, be with us till the end. In Jesus Christ I pray. Amen.
Good evening. I believe we might be waiting for Mafina. He might be very busy now. Can someone else take over? Question 239. Let's start. Question 239. Activities during post-visit phases of home visit include A. Developing a future follow-up care plan. B. Integrating the patient into the community. C. Transferring patient care to another agency. D. Sharing reports of home visit with relevant authorities. Let's attempt that question. That is question 239. Question 239. I can see people going with 239. 239 a minute. I can see people going with 239D. That is keep Mercy go with 239A. Muchama go with 239D. Sang kindly number your work. Kindly number your work. Midadi going with 239D. H0, H1 go with 239D, Sam 239A, Win 239A, Barnes 239A, Someone BKE 239C, Midadi 239D, Chill 239A, Acheng 239D. So we have three contradicting answers, that is A, C, and D. We have no B anywhere. We have no any B. Now, can we get something about this one? That is an evidence. An evidence on this one. A says developing a future follow-up care plan. B, transferring patient care to another agency. That is C. D, sharing the report of home visit with the relevant authorities. What are those phases of home visit? Maybe someone can send us those phases so that we can see we can go through them. Thank you, thank you. This is who? This is Della. Components of home visiting. We have number one, initiation phase. The community health nurse clarifies the purpose of the visit and also share information on reasons to purpose for home visit with the family. The nurse introduces herself, himself to the family and establishes nurse-client relationship. We have number two, that is pre-visit. In pre-visit activities, the nurse needs prior information regarding the home and the family, which includes location of the house and distance. The CHN initiates contact with the family, determines family willingness for home visit, and review the family health records. This part of assessment of the family. This is part of the of assessment of the family health education needs. We have number three, activities during the home visit. The interpersonal relationship starts when nurse enters to the house. The CHN takes a variety of roles when intervening for client care, e.g., through health education, epidemiologists, etc. Number four, termination phase. Uh, Termination occurs when nurse-client goals are reached. Number two, a patient changes his residence or leaves the home. The nurse transfers the patient care to another nurse or other member of the health team. Uh, that is a short answer question huwa inaulizwa. We have number five, post-visit activities. Post-visit activities include recording and reporting, i.e. the nurse records the visit and plans for the next, e.g. formulating a lesson plan. We have the advantages of home visit. Home visit provides an excellent opportunity to implement the nursing process, provides the opportunity to study the home and family situation. Number three, provide an opportunity to render service to the family members at their own surroundings. Uh, Five, home visit clarify doubts raised by the family members. Help to observe practices and progress of care given by nurses and other players. Help the nurses and family members to modify the way of their care. Convenient for the patient and facilities patient control of the setting. Best option for patients who are unable to travel to hospital. The last one, home visit, provide a natural environment for the discussion of concern and needs. Qualities, conducts, attributes, you can go through them at your own time. We have another evidence from Kendi. Post-visit activities include recording and reporting important events of home visit and sharing the reports with the appropriate authorities and individual about the patient family. I think with that we can see T. With that we can see T. Type the cities as I get the next question. Thank you so much for the evidences. They are timely. Those evidences are timely and directing to the correct answer. Now, can I get the next question? The next question. The question are just up there. As well as someone to update the score sheet. Question 240. Thank you, Mercy. Herd immunity exists in a community when A high percentage of people are immune to an infection, B the incidence of the disease decreases to a very low level, C vaccination is stopped in a community that has been well, D both dead and live antigens are used to immunize. Let's go attempt that question. What is herd community first? What is herd community? Definition of herd community. Maybe someone here don't know the definition of herd community. Someone can type the 80% of the community is immunized. Thank you, thank you, thank you. Now, can I sit here? Can I sit here? Can I sit here to save time? You can look. You can look at the other types of immunity. Thank you. The next question. The next question. The next question. 241. Question 241. Hence they act like a buffer. Question 241. The cycle of a disaster consists of the following components. A. Mitigation, preparedness, response, recovery. B. Preparedness, vulnerability assessment, risk assessment, recovery. C. None of the above. D. Mitigation, risk assessment, response and recovery. Tuanguke na hiyo hata tumalize dakika moja na we have discussed it today. At 2 p.m. CTA, mniambie CTA. Haya, the next question. And why is Mercy sending the question as well as updating the score sheet? Saidiani Mercy hata ya concentrate. Nani atachukua score sheet ama questions? Wachani Mercy afanye kitu moja. Because we have so many participants. Thank you, sensational. Mercy, you can now send me the questions only. Nitumie question 242. Sensational, asante. Question 242. Question 242. The sequence of therefore the psychoanalytic stages of psychosexual development in children are A. Olo-anophallic latency, B. Latency olo-anophallic, C. Phallic ano latency, D. Olo-phallic latency ano. Tuanguke na hiyo. What is the order? A. Thank you for the attempt. City, then write the cities. Any evidence? Okay, someone can send those psychosexual stages. Yeah, someone is asking on the evidence. Kuna hii mnemonic on this one. Hiyo najua nayo haiwezi kosa. Can we get something for the sake? For the sake of our colleagues. Evidence. Na someone with the mnemonic for that one also to type. Old age pension love grapes. That is a mnemonic. Thank you. Who is this? Shori ametuma evidence in form of a PDF. Now I will go through this one, which is screenshotted by Kim. 5 stages of development. Freud argued that human beings develop through a series of 5 psychosexual stages. These stages try to express the sexual energy, libido, and aggressiveness in various forms in each stage. He further argued that deprivation or overindulgence of this energy leads to a scenario he referred to as fixation. We have number 1 oral stage, 0 to 18 months. In this stage, the pleasure is achieved through stimulation of the mouth, e.g. thumb sucking etc. Primary conflict, winning. If fixation occurs, the individual would have a dependency or aggression. Oral fixation can result in problems in eating, drinking, smoking, pen, stroke nail biting, gum chewing, abusive. We have anal stage. Anal stage imeelewa. Keep unaweza resend. Naona hapo anal stage haiko clear. Thank you. Anal stage, 1.5 years to 3 years. Pressure is achieved from holding and expelling feces, i.e., bladder and bowel movements. Conflict occurs regarding toilet training. Praise and reward for using the toilet at the appropriate time encourage positive outcomes and help children feel capable and productive. If punishment, ridicule, or shame for accident is used, then it can result in the anal expressive personality. Lack of self-control, generally messy, stubborn, wasteful, or destructive. If patients are too strict or begin toilet training too early, anal-retentive personality develops in which individual is stringent, orderly, rigid, obsessive, and perfectionist. The next, that is phallic stage, 3 to 6 years, primary focus on genitals, hence is characterized by sex and gender identification. Oedipus complex for boys and erectile complex for girls. Fear of castration known as castration anxiety. Girls develop penis envy. Fixation, sexual deviances, into bracket of, overindulging, or avoidance, weak or confused sexual identity. 5 stages of development. 1. Oral stage, 0 to 18 months. In this stage, the pleasure is achieved through stimulation of the mouth, e.g. thumb sucking etc. Primary conflict, winning. If fixation occurs, the individual would have a dependency or aggression. Oral fixation can result in problems in eating, drinking, smoking, pen, stroke nail biting, gum chewing, abusive. We have anal stage. Number 4, we have latent stage, 6 to 12 years. In this stage, sexual impulses are repressed. Individuals in this stage develop social friendship and socialism characterized by group formation and fierce group loyalties. Boys cling together and shun girls, and the girls despise boys. The child identifies peers and is occupied by school, work, and play. We have number 5, genital stage. Before genital stage, kuna the last point of the latent stage. If successful, because the parents were not supportive and challenging, the child becomes scared and timid and will hate competition. He will not try anything because he knows he's a failure. Number 5, genital stage, 12 to 18 months, 12 to 18 years. This is the adolescent stage. Gratification is obtained from actual genital stimulation, hence there is development of intimate, romantic friendship with the opposite gender. Identify with an adult they want to emulate from the previous stages and start behaving like those adults. They tend to resent commands, disagree with parents, want independence, and behave like mature adults. Lack of support and understanding leads to rebellion, run away, truancy from the family, joins gangs where they start abusing drugs, present antisocial behavior, and will never be what or who they are expected to be, i.e. role diffusion. Thank you. We have other evidences from Blake, other from Victor. The Victor is a bit simple, 0 to 1, focuses on mouth, teeth, and gums. Arno, 1 to 3, yes, focuses on control and self-control, primary toilet training and defecation. Phallic, 3 to 6 years, focus on genital stimulation and gender differentiation. Latency, 7 to 11, energy focus on non-sexual activity. Genital 12 plus, development of mature sexual interest. Your net. Oh, my net ni mbaya. My net ni mbaya. My net ni mbaya ama iko sawa? Am I audible? Iko sawa? Oh, it's fine. Okay, with that, can I sit? With that, can I sit? Nipate the next question. The next question. Thank you. And question 242, the sequence. Hiyo tumefanya. The next question. Question 243. The epidemiologic triad of disease causation refers to A. Agent, host, environment. B. Source, mode of transmission, susceptible host. C. Host, vector, source. D. Host, port of entry, source. The epidemiologic triad. What is it? Attempt that question. Sorry, I had a call. What are people saying on question 243? Watu wanaenda na 243 A, and someone has gone with B. Someone has gone with B. For the sake of that person, let me have the evidence. Let me have the evidence kindly. Let me have the evidence. Being a cycle of disease transmission. Being a cycle of disease transmission cycle. Thank you, Geoff. Ametuma evidence kuna agent, host and environment, whereby agent to host is indirect, agent to environment is indirect. There is a vector there. Okay, with that, I think we can city. Type the cities as we go to the next question. The next question. Thank you. Question 244 says, Mr. J is angry at Mr. R for not presenting his grievances. Instead of complaining at Mr. R, he complains to Mrs. C. The defense mechanism exhibited by Mr. J is A. Regression, B. Denial, C. Displacement, D. Projection. It's kind of a familiar question. Everyone is going with 244C. There is no there is one. Jenny is going with 244D. Can someone make him or her understand, explain to him or her? Yes, evidence is at 244. Yeah, you can share also the evidences. I can also check kama nilikuwa nimesave mahali. An evidence on this one. C says displacement, D projection. Thank you for the evidences. Thank you, Nadine. Freud's defense mechanisms. We have denial, refusing to accept reality or fact. We have repression, blocking disturbing thoughts from consciousness. We have displacement, redirecting impulses onto powerless substitute. Rationalization, making excuses for unacceptable behavior. We have reaction, behaving in opposite ways, opposite way to how you feel. Introjection, taking on behaviors of someone else to avoid distress. Identification, adopting behavior of hostile person to avoid abuse. Sublimation, channeling impulses into socially accepted behaviors. We have regression, reverting to an earlier stage of development. We have projection, putting own thoughts or feeling on others. Oh, nisi hizo, lakini hizo terms huconfuse. Okay. Then pia Nick ametuma evidence, kuna repression, denial, projection, displacement, regression, sublimation. Yes, you can go through them. You can save them. Actually, you can save them so that when we need it tomorrow, you will be able to send us or access it for those who don't have it. And now, can I go to the next question? Nipitie. Okay, I can go through it. I can go through them. Yes, we have repression, mechanism, repression, description. Repression is an unconscious mechanism employed by the ego to keep disturbing or threatening thoughts from becoming conscious. Example, during the Oedipus complex, aggressive thoughts about the same sex parents are repressed. Oedipus complex ni boy ama ni girl? Haya, we have denial. Denial involves blocking external. Someone is saying CT, please. So you will be able to go through them at your own time. H0, H1. You are the one requesting for me to go through it. Keep anasema lakini mbona hasa inakaa D? Tujibu keep. D, what is D saying? D. I second. I second. Mbona hasa inakaa D? Now, can I have the question down here? Oh, we have C displacement and D projection. C displacement and D projection. I will just go through the two. That is displacement and projection, so that you outweigh which is which. Let me go through the displacement. Displacement says satisfying an impulse, e.g., aggression, with a substitute subject. Example, someone who is frustrated by his or her boss at work may go home and kick the bucket. That is displacement. Then I have projection. Projection. Where is this projection? Projection says attributing feelings or impulses unacceptable to oneself, to another person. Example, Sue feels a strong sexual attraction to her track coach and tells her friend, "He's coming onto me." That is projection. Also projection from Nadine evidence, putting own thoughts and feelings or feelings on others. Midadi, you can talk.
Okay, I don't know if I will assist those people going with this. So according to me, I know displacement is basically removing, for example, if somebody has angered you, so you'll, before, let's say it's your husband. So your husband has angered you, so you'll try to displace it. It's like just removing from for the lesser threat, removing your anger, displacing your anger to a lesser threat. Your husband have angered you, but now you come to the children and start punishing them. So you go to the lesser threat. So according to the equation, we were told Miss J is angry at Mr. R. So why is he going to Mrs. C then? Because Mrs. C is the lesser threat. And when we go to projection is all about, for example, amka asubuhi na visirani zako, hatujui vitu zimekufanya, it's your inner tu ya visirani zako. So unafika kwa kazi unaanza kugombanisha patients. That's like projection from your inner. Hakuna kitu imecause, not the external. Si ati for example someone amekukasirisha atafu unakuja kugombanisha patient, hiyo itakuwa bado displacement. So projection ni your inner to your feelings. Saa zingine you are jealous of someone, so akipita tu hapo unaanza kumwambia we ni mjinga nini. You are jealous tu, saa zingine akona kitu ako nayo na we hauna. So your inner projection, you're just projecting what's inner. It's always associated with their subconscious, most of it, but says in get deep. But just no displacement from the going to the lesser threat. For example, msebiga amekunaenda kwa mtoto wenyu mdogo. So from the, ndio maana unaonanga watu wengine wanagombanishwa na masa yao, wana slap mtoi wao, brother wao mdogo, because sasa huyo ni lesser threat, haizi confront his mother ama haizi confront his husband. Hivyo ndo hivyo. I'm done, Escobar.
Okay, thank you, Midadi. Now, we have agreed that it is displacement, right? Tumekubaliana? Then I can have the next question. Yes, CTC. The next question says, the main objective of community mental health is A. Reduce stigmatization. B. Reduce or minimize congestion in psychiatric hospitals. C. Nurse the patient near at home where the family and community members are. D. To incorporate the patient into the community. Question 245. What is the main objective of community mental health? I can see everyone is going with 245D. That is Achieng, Santana, Mercy, Carol, Teddy Barnes, Mochama, Mr. White, BKE, Eve, Nadine, Axmedi, Babyline, Just a Baby is saying loving the explanation. Okay. Tara Mofin, Kathy, Nick. 100% of the active participants are going with D. D, that is to incorporate the patient into the community. JK ameenda na C. Someone is also asking why not C? Why not C? Tujibu active participant, tujibu hiyo. Why not C? What is C? C says the nurse the patient near a home where the family and community members are. Can I get the evidence of this one? I believe it is there. Yeah, King Rick go with 245C, just Abeba 245C. Keep 245D, H0H1, 245D. Naweza pata evidence ya hii. Rationale for C. JK anasema community mental health and extension mental health services are quite different. The latter is for introducing members back to the society. That is the rationale for C. That is the rationale for C. It's offering mental health services, but from the community setting. Naona watu wa C wame D outweighs C. It's a long-term intervention. My input though, Mofina anasema now what is it? C or D? Sijaona something that I can read that is evidence. Sijaona kitu naweza wasomea. Kuna mtu wako na kitu naweza wasomea? Mnasemaje? Usinyamaze hivyo because of time. Kuna something I can read. Kuna mtu ako na evidence on this one? An evidence na watu wa D wamekwamilia D na watu wa C wamekwamilia C. At first, in African setting, people with mental problems, they are being stigmatized, so it's the role of mental health to incorporate them. Mochama is supporting answer A. Is it A? Mochama amesupport A. Reduce stigmatization. Mnataka evidence ya Google? Tutaki ya Google. H0 H1 hatutaki evidence ya Google. D. Mochama. Oh. Mochama anasema ni D. Na mimi naona kama Gachagua tena ameenda na A. C is correct but ultimate goal is D. Mnakubaliana na morphine? My people tunakaa kwa hii swali sana. Thank you Koechi. You have components of community care. You have concepts of community care. I'm trying to look. Wacha nianzie hapa kwa concepts of community care. The basic requirement of community care involves the treatment close to the patient home, comprehensive services, multidisciplinary team approach, continuity of care, consumer participation, program evaluation and research. What are the two main components of community care? There are two main components of psychiatry. The two main components of community psychiatry are promotion of positive mental health, prevention of mental illness. Share the PDF kindly. Mi naona D outweighs C. Can you allow me to sit to the next question? Ama tukubaliane ama ni D ama ni C. Msema kweli wa D. Msema kweli wa nini? Ni wa D ama wa C? Ni gani? CTD. Just CT. Wewe endelea tu. CTC. Between nursing the patient and incorporating, which comes first? Ni gani inakuja ya kwanza? Nursing. Sasa ni CTD ama C? Ni CTD ama si? CTD. CTD. Let me CT hata kama ni star. Remember we started late, now staying more than 20 minutes in one question might mislead us. The next question says the key characteristic of CTD with a star. The score sheet. The key characteristic of transactional leadership include A. Guiding, monitoring, motivating. B. Guiding, commanding, motivating. C. Guiding, domineering and motivating. D. Guiding, domineering and demonstrating. Transactional leadership. Hii ni type of leadership. Watu wanaanguka na A, question 246. Watu wanaanguka na A. Watu wengi 100%. Let's minimize CT star. Kuna swali ya morning tuliacha hivyo. Morphine anasema tu minimize ku CT star. Kuna swali ya morning tuliacha hivyo. Yeah. The question is asking for objective short-term intervention, which is clearly C. Option D is a goal and reflecting long-term. JK Times is saying. About question 245. Kuna mtu anaweza ihandle vizuri tuelewe. Can we get someone who can make all of us understand? Basi ndio tusisiti na star. Nani? Kindly kama unaweza explain so that others can understand well. Unaweza unmute and Morphine, sawa, unmute and explain to us.
Thank you, moderator. So with your permission, on question 245, maybe you can just resend whoever was sending the questions. Just send again. Kindly just resend again that question. A humble request. Yeah, thank you. So these options, at the end, you get the two options are the confusing, that sometimes they are correct, but you have the most correct one. That is the thing. You get the two options are correct. The two confusing options are correct, but you have the most correct option than the other. In simple, one option must outweigh the other. Back to our question, then we are told the main objective of community mental health. The main, yeah. So it might be the two options might be correct, but the main. So we are told. So everyone was basing the answer on. Our argument on C and D. So C was saying, nurse the patient near the home where the family and community members are. That is true. Okay, by the way, this is just my input. It's not something, no one has a monopoly of knowledge, but it's just my input though. So we are told the nurse the patient near home where the family and community members are. That is true. Then D, to incorporate the patient into the community. Back to the psychiatry, when you do a psychiatric placement, you handle all the kind of patient, yes? Patient with schizoaffective disorders, patient with the alcoholic intoxication, delirium. But at the end, we have the 3 level of intervention or level of prevention. Yenye tunasemanga primary, secondary, and the tertiary level. And then, when you are in the psychiatric or in mental health, when you just on the concept of mental health care, what is our ultimate goal when caring for the patient who has the mental issues? Just let me just base my argument on that line. What is our ultimate goal? Our ultimate goal is to incorporate this patient into the community so that they will continue to be productive like the rest. In somehow a rehabilitation, so that at least they join the rest of the members in the society and continue to be productive. That's our ultimate goal. So, which is option D. That is our main goal, to incorporate them into the society or the community. And C also is correct, but C is it's a short-term intervention. C is a short-term intervention, but what is our ultimate goal? To incorporate them into the society or the community. Back to you. Thank you.
JK.
Hello. Am I audible? Sijui kama nasikika. Mnanisikia? Oh, okay. So, thank you so much, Mofin, for that explanation. However, I do share a different perspective on this. You see, the question in all is to the main objective of community mental health. I think at some point I once talked about the difference between objective and the goals. Objective is short term, and ukiangalia choice, it's the short term here. The ultimate goal here is to incorporate the patient into the community, but that's not an objective. It's a goal. So choice D is basically the main goal of community health, community mental health. Choice C is the main objective, is the short-term intervention, which is reflecting choice C. Back to you.
Okay, thank you for the explanations. That is from Mofin and from JK. Someone is saying she made it. Oh, inahitaji ujue definition ya objective. That way you can rule out D, because D is a goal. But the goal of care is to incorporate, right? Fungua wengine macho. Keyword is objective. So, to me, after C, we reach to D. And after providing the patient care near the home, which later leads to the patient being incorporated to the community, we need an objective. So C, yes. Now, we can sit it from there. How about you if we look at it like C? It's an approach to achieve our goal, which is D. How about if we look at it like C? It's an approach to achieve our goal, which is D. I can see people are typing. So si tunakubaliana kwanza si ni objective. But the question is asking for an objective. Soma swali tena polepole, you get it. We are overthinking. Na ndio maana I said I was to city even if it is with a star, because it will enable us to cover more than this morphine. By the way, there are answers for these questions. Someone can check for me. Answers zilikuwa zinasema nini? For the admins, I know you have the answers. Answers zilikuwa zinasema, answer ilikuwa inasema nini? Two 45. Two 45. Answer ilikuwa inasema nini? Watu wanafikiria unasema wana overthink. Let perish with deed, guys. Acha bwana, if we perish we perish. Aki tusitii tu, tuendelee tu. Hata sijafanya question 246. Tumefanya question 246. Tumesema ni? Oh, zilikuwa mbili zinafanana. 246 ilikuwa A. Oh, okay. Tusitie out of feelings. 247 sijasoma. Warning signs of suicide is A. Making overt statement like I can't take this anymore. B. Inability to take food for several days. C. Wandering. D. Inflicting self-harm. Question 247. There are people going with D, others are going with A. Ni gani warning? Which is a warning sign? Ni ya kusema ama ni ya kufanya? Ni gani? Which is more of 247 naona watu wanaenda na D, wengine wanaenda na A. Self-harm anaweza hata jidunga na pena ama ajiume kidole, but A means amefika mwisho. Warning ni onyo, hajajaribu kufanya bado. Okay. Alright. Nasikia kujidunga kitu ni kufe. Nigawie hii akili. Now, I think I need. Can someone share something about this one? Can I get an evidence on this one? Kuna mtu ameshare something, Mr. White. The growing openness of the hospital to the community, the interdisciplinary efforts in the field of mental health at research and treatment levels, increasing emphasis on research. Hiyo ni ya nini? Oh, I think ni ya question 245, increasing emphasis on research and epidemiological investigation, incorporation of knowledge from fields such as social psychology, sociology, and anthropology in order to provide greater understanding of social phenomena. (247D, 247A). Evidence ama rationale. Rationale ya A na rationale ya D. Of which rationale ya A wamesema rationale kindly. True, it's not a warning. It's actually known as parasuicide. Hata kama alijiuma kidole. Also, people always talk before they actually do it. Okay. From the arguments, what are we going with? What are we going with from all the arguments you have presented? From all the arguments you have presented, give me the power to CT. People are saying CTA. Okay. KEPI ametutumia very good evidence, warning signs of suicide attempt, talking or writing about death, talk to suicide, wanting to hurt self, looking for ways to kill self, feeling of hopelessness, putting personal affairs in order, writing a will and apologizing for the wrongdoing, suicide in drawing, school essays, poems and notes on suicide, giving away prized possessions often accompanied by statements of sadness or despair, uncontrolled and anger and seeking revenge, acting reckless or engaging in risky activity, feeling trapped like there is no way out, increasing alcohol, drug abuse, withdrawal from fields, family and society, anxiety, agitation. Obim, sawa. Unmute and talk to us.
Thank you so much. I think in diplomacy, A and B are both signs of what a person who wants to. But I think at this point we look at which one has a higher level. A higher
Obim,
level.
Obim, kindly you can start and
Can you hear me?
yes, now you are okay.
Okay, sorry about that. I was saying in my own argument, I think both is A and D. That is, I can't take it anymore. The inflicted harm. Both of them are warning signs of. I don't think they have equal danger to assess if a person is taken alive. I feel phase B is much more of a higher level as compared to phase A. Means that when a person starts to inflict and anajibwara gonga on something just to try they are taking a much more big time than saying I can't take it anymore. I'm not taking out anymore time, but a time, but of a lower level of voltage. So you take it to people are people, emotional overload, home their ability. So this is a farmer if you compare the level.
Obim, actually mimi sijakusikia, nimekusikia tu jina moja moja. So even I didn't hear what you are trying to mean.
Wow. Can you hear me?
But karibia mic kabisa, kuna venye ukianza kuongea then unapotea.
Hapo unanipata vizuri?
Hapo uko sawa.
Okay, I was trying to argue my point, but I stand corrected. I was saying both choice A and choice D are warning signs of a person who wants to take their life. But I think now we have to assess the level of danger that they pose. I think choice D is have like more weight in terms of when a person reaches a point where they start inflicting harm on themselves, now becomes like iko level ingine as compared to mtu anasema I can't take this anymore. I'm not ruling out that I can't take this anymore. It's not a sign. It's a sign, yes, it shows a person who maybe is having emotional overload or losing the ability to cope. But I think in this case we should assess this one poses a greater risk of a person who wants to take their life. That's my argument, though I stand correct.
Okay, thank you. That is his argument. His argument, I think anasema actually I can see people also having the same argument. Kuna mtu amesema hapa hakuna mtu hajaisema sema nini, nimeona kitu kama hiyo. Hata GBV inaanza na kusema nitakuchapa, verbal warning, but before it's actually put into action. I think it is also relating to the same. Kila mtu hapa ashaisema I can't take it anymore na bado mko hai. Yeah, that is what has been explained also. Yeah, so that makes A more dangerous. Self is done to avoid suicide. Yes, so that makes A more dangerous. How do people say A? And how do people say A? D is moral parasuicide, which is a major cardinal sign of suicide. That is morphine evidence yako. I agree with you. They are fighting the thoughts that way. Leo naona ni mbaya. Wewe ulikuwepo? Majirani wangu. Warning signs guys, onyo yani. The actual event is yet to happen. Acha nikatafute William. Na kwani mtu alifanya hii pepa na tuona tu tukiangamia. Tunajua imani. Mtafute juu hapa naona ni mbaya. Sema kweli iko wapi? Si magani mjini. I totally agree with you, senior. Leo kwani leo ni lini? Evidence ndio hii talking ni number one before inflicting pain on self. CTA. Once again I CTA on this question. Now how will I CTA and D, my people? How will I CTA and D? Kwani maswali za leo ni ngumu aje? Can I talk? That is Liv. Yes, Liv, you can talk.
So my view ni mnanisikia? So my view ni una CTA cause kusema like I cannot take this more. Hii ni an overt statement yenye ina express hopelessness or inability to go on na iko direct and it is a serious warning sign ya suicidal ideation. Option D inaweza kuwa associated with any other mental illness like pain on yourself kama like any other mental illness inaweza kuwa na differential diagnosis, lakini iko very much direct and a serious warning to suicide.
Thank you. Now, pia mimi naweza sema kitu about this one. When somebody really want to commit suicide, I believe that person haongeagi, he will not even talk much about it. So, someone who is talking, I don't think that is really heavier than D. Huyo mtu aongeagi, mtu mwenye anataka kucommit suicide. Twende next question. Msema kweli inakuja. Leta leaks ya msema kweli. Hello colleagues, what happening? Leo niko off na watch leaks. Koecha ametutumia kitu, what is attempted suicide? Attempted suicide is an act of self-damage inflicted with destructive intention. However, vague or ambivalent is an attempted suicide. If the patient dies as a result of the act, it is called suicide. Otherwise, it is called attempted suicide. A suicidal attempt with self-destructive intention is attempted suicide, whereas an attempt without any intention of dying but only to threaten or manipulate others is called parasuicide or deliberate self-harm. Attempted suicide is a cry for help. It is an act of despair. Nadine, ongea.
Okay, I'm saying for people who are like who have like suicidal ideations, most of them they say it like they say it out loud, but they say it in a like wanna it's like unafaa like upik. That's why unafaa upik kwa sababu in a way that in a sound like a joke, but they actually mean it and they do it. For self-harm, they wanaji self-harm ndo wa avoid commit suicide. Like nitasemaje? But for people do verbalize, they say it as a joke and they actually do it. Most of these cases are suicide. You will hata ukiuliza, most of these cases are suicide. Most of them say it, but they say it atakwambia like ni kama tu it's a joke. Then unakuja kujua like it was serious after they've actually committed suicide. But self-harm, so I wouldn't go with choice D, because choice D like hiyo ni a way ya kuwa distract ndo wasicommit suicide. I don't know if it's getting or not, but for verbalizing, it's super okay. I'm not saying that D is not serious. They're both serious, but A is more dangerous. Like in this case, it's more dangerous because they verbalize and they actually do this. Like ata commit suicide right now, but they will do it. Asha kwambia. So you're supposed to pick, like, if you're having a conversation with such a person, you're supposed to pick hizo vitu zenye anasema and you're supposed to listen keenly ndo ujue. Otherwise, they just commit suicide. Utabaki ukisema alikuwa mention but as a joke. Yeah.
Okay. My people. We are remaining with 20 minutes. Tuko na 20 minutes. Oh, kuna mtu ametuma something. Acha nione. I was trying to look at the answers, but sioni answer hii question. Maybe kama kuna mtu anaiona anaweza nini. JK, ongea. Unmute and talk.
Sijui, unanisikia? Unanisikia?
Yes.
Masaa ni mbaya. Okay. So actually this question is direct. Miss Jimbona, we are having quite an argument here for 245 and 247. You see, the question is simply asking for a warning sign of suicide. I actually want us to understand that the term suicide does not mean that the definite end or the definite goal will be death. No, we have several types of suicide. We do have attempted suicide. Then we do have the actualized suicide. So you see, inflicting self-harm is a type of suicide. So it's not even a warning sign. It's a type of suicide itself. And it falls under the class of parasuicide class, okay? Whereby you attempt to kill yourself, but then you fail because the attempt or the impact wasn't enough to result to death. So suicide is not entirely, it's not entirely confined. It's not entirely confined to death as a final destination. However, sometimes you can commit suicide, but still without success. So that can be attempted suicide. Then sometimes you can just inflict pain, cause harm, then that is termed parasuicide. Another thing as to why D cannot be a warning sign is because inflicting self-harm does not mean that it's related to suicide. You can just inflict self-harm for other reasons. And most of the times we inflict self-harm to counter the suicidal impulses. It's like OCD. You're just trying to do that thing so that you lower the anxiety, and the anxiety is suicidal ideation. So you just inflict the self-harm to lower the suicidal impulses. So it's like a defense mechanism, but it's not a warning sign. Back to you.
Okay. Now, so many explanations has been provided. I don't know, bado mna people for this, are you agreeing the mnakubaliana na rationale ya A ama watu wa A mnakubaliana na rationale ya D? Which is which? Nimekosa hiyo jibu. And Nanok, I can see like it's not available. CT. Escobar did this. Thank you. Let me read this. Self-harm and suicide attempts are different. We have frequency. Self-harm incidents are very frequent. In suicide attempts happen less frequently. Methods: cutting, burning, self-hitting. Let me just finish by one. We have frequency, methods, severity, purpose. I believe we'll go together on this one so that we go together. Self-harm, we have hidden are very frequent. Then method: cutting, burning, self-hitting. We have severity, less severe. We have purpose, done to avoid suicidal purposes. That is on self-harm. Then on suicidal attempts, frequency attempts happen less frequently. Method: self-poisoning. Severity much more severe, sometimes lethal. Purpose: done with an intent to die. So we have self-harm and suicide attempts. Basically two different things. Ama tuseme kama mtu na msaba wake. Moderator, and the next question. Tutakesha hapa. You can only see TA if a suicide didn't exist in that question. Yes, as per that piece, self-harm is a coping mechanism to avoid suicide. CTA. Midadi. Unmute and talk.
Okay, so me, I just have a question for the people going with A. So according to the evidence, we are told that warning signs of suicide attempt talks or write about death. So write about death, stroke, suicide. And the second one wants to hurt oneself. So is talk or write about death, stroke, suicide. So according to our statement, according to that statement, I fail to see where that statement there is death, because it's just a statement. I can't take this anymore. Where is death there or suicide attempt there? I can't take this anymore. Even you, when you are tired, you say I can't take this anymore. It's like giving up. So if you can just answer that, we can just CT. But I can't take this anymore. Doesn't mean there is no death there or suicidal ideation in that statement, according to me. Thank you, moderator.
My point to it may even mean extreme hopelessness or worthlessness, which is still a warning sign. Idadi. H0, H1. You can talk. Can unmute and talk. H0, H1. It seems like he or she is not able to communicate, so it could be suicidal or not. CT2A has a lot of gaps. Midadi, please understand that suicidal is not a predilection to a death. Not all suicides are death cases. Some are parasuicide. You wanted him or her to say, I am going to kill myself. Nimechoka hapa, tutatoka mno. To city moderator, still a bunch of questions ahead of us. That's why you do psychiatry as a unit. You are supposed to pick this from conversations you have with a client with a suicidal ideation. Acha niende hivi kidogo nikunywe supu ya miwa. 500. It is already a suicidal behavior, not a warning sign, but verbal expression are warning signs of suicide, which must be taken serious. I can't take this anymore, VCT. Now, nipe next question. The others are okay. The other questions are okay. Stan wants to talk to us. Stan, kindly unmute.
Thank you, moderator. I just wanted to say that we're having a number of questions that, some of them might be so critical when it comes to answering, and we may not really settle to one of the, we may not really settle to either the two of them. So in this context, Mr. Moderator, we can just perhaps, if we don't have a confirmatory evidence to support the answer, most of the time we need to rely on the evidences that we've had. And there's no evidence that has said self-harm is one of the warning signs. We don't have any evidence that has supported that. So in that case, we just rely on the evidences, and in case of anything, or in case of any other evidence coming up to support the same, we can rely on that. If we don't have any MedScholar confirmation, so that we also save on time, we also know we have a number of questions that we need to tackle. So just by the way, so for that case, for people still support with option D, always, at least we need to rely more on, sometimes we can be having subjective information, but we tend to rely more on the evidence for the objective part. So let's not forget about that. So back to you, moderator.
Okay. Thank you, Stan. Actually, that is a good view of the same. Tukuwe tuna rely na the evidence is provided so that we don't waste a lot of time, because now from 9 a.m. to 10 from 9 p.m. to 10 p.m. we have just done one question, na hata bado naona argument haijaisha. It means we have to do something on that. Now, the next question, that is question 248, says a vocation requiring specialized knowledge and long extensive training is referred to as A. Occupation, B. Specialty, C. Profession, D. Career. Let's try to answer that question quickly. CTB. I can see Jenny going with 248C. Others are going with 248B. Provide a rationale so that Jenny can understand and we sit it together. B says speciality. That is a vocation requiring specialized knowledge and long extensive training. Hakuna mtu wa C? Kuna mtu wa C? Ndo huyu. Pia kuna D, JK times. Haya, rationale for D. Naona enemies of progress. Yeah, evidence on this one. Kila mtu aleta evidence. Mtu wa C aleta evidence na mtu wa D aleta evidence na mtu wa B pia aleta evidence. Kindly. Specialized knowledge, key term. A key word, specialized knowledge. People with specialized knowledge are called specialists, i.e. endocrinologist. Mko na evidence? Munitumie. I don't have the marking scheme, Mr. Moffin. Career is different from profession. Progression is a broad career, while specialty is specific area within profession. Thank you. Nimo. Sasa long extensive training, Professor. I can see only people for going with B are the ones who are typing the rationale. What about the other? Mwenye ameenda na C na mwenye ameenda na D hajatupea rationale. Leo mumeamua hakuna kuseto haki ya nani? Thank you, Klimek. Professionalism and trends in nursing. Professionalism, calling, vocation. Hiyo ni requiring specialized knowledge. Can't read that. H0, H1. Thank you, JK. Career definition, the progress and actions taken by a person throughout a lifetime, especially those related to the person occupation. A career is often composed of jobs held, titles earned, and work accompanied over a long period of time, other than just referring to one position. Career development definition. Hii ni rationale ya nini, JK? Hii ni rationale ya nini? Okay, Kilimeka ametutumia na ametuhighlightia. Bellier's Nurses Dictionary defines a profession as a calling, vocation requiring specialist knowledge, methods, and skills, as well as preparation in an institution of higher learning, the scholarity. Scientific and historical principles underlying such methods and skills. The dictionary further states that the members of a profession are committed to continuity study, to enlarging their body of knowledge, to practice services above personal gain, and to provide practical services vital to human society and social welfare. It adds that a profession function autonomously and is committed to higher standards of achievement and conduct. City profession. Okay, can I city profession? Munipea cities. We close it there. Nimekutumia clear definition. Tena tunaenda kwa mambo ya damu. Okay, let's close the session there, then we shift to unit wise. Umenitumia lakini umenitumia Google. Sasa, you know when we read something from Google, that thing will never end. Okay, let's end the chat. Tutamalizia, tutaomba unit wise.